Hi, good evening. I'm Dr. Philip Macmillan. Thank you very much for joining me. And I have taken the opportunity to talk about something that I've been intending to share for some time, but have just not had the opportunity to put it together. And it's about a most critical interview that I had in late 2021 with an ICU doctor from Honduras, and the information was so valuable at the time. And I thought that this would be a game changer for the pandemic, but instead it was censored on social media because of misinformation. I can't share the video, but I can share a few clips that will give you an idea about what was being shared and why it was so important. Critically, this information was done at a national level, and the outcomes you can see here, which I'm going to go through. This is deaths related to COVID 19. But let's get back to here now. Before I start sharing with you the clips and some ideas about what they've done and why it may have worked, just want to remind people who may have missed the webinar, Infertility Vax Nightmare. If you want to see that, you click on the link below. It will take you to a significantly discounted course content. And essentially, what I want is people to be able to access this information. And if you find it valuable, please, there's a donate button there as well to Macmillan Research. We really appreciate any kind of support that you have. So please, if you're interested, go at the link below and you'll be able to see the full webinar in taken put together for you. So let's get back to the point at hand. Honduras Censored for creative approach to saving lives. So the backdrop of this is that Honduras, a small country in Central America, was being severely impacted by the COVID-19 pandemic in middle of 2021. This was just around the time of the Delta. And they had limited resources, and so their doctors had to get very creative because they had no options at the time. No one was really willing to help them, and it was up to these doctors to try and find solutions. And to put it in context here, I'm going to have an image with regards to this is from All World in Data. I'll make it full screen here. And this was essentially where they were going in July into August 2021. Their cases were rising. They had one of the worst outcomes with regards to death. So this is just confirmed cases at the time. So their doctors had to become creative because they had limited options. And they had limited resources and they came up with a strategy that would hopefully help to save lives across their country. Here is the first clip that I want you to hear from Dr. Fernando Valiero, who was the ICU doctor at the time, and listen to him talking about some of the issues that they had at that point. Important to position the fact that Honduras has a population of about 9 million. And you guys, I think in your slides, and probably it's wise to bring up your slides, some of your slides here, is that you guys only have 125 critical care beds.
That's right.
And if you compare it to, say, New Jersey in the US, which has about 9 million, they have about 1,800 to 2,000 critical care beds. So the difference is huge in between, most first world countries in terms of resources on the ground, which is why the results are so stark, so stunning, what you guys achieved with regards to hitting those numbers.
That's right. We are very underserved. We are very understaffed. We were able to increase the amount of beds for just ICU beds. I think we increased the numbers to another 125, 150 beds for the entire country. And we have very few intensivists, pneumologists, emergency doctors. We just have one infectious disease specialist in the city of San Pedro Sula that has over 1 million people. So what we did is we spread the word. We educated all the doctors of all the hospitals of Honduras. We gave over 200 different webinars to address and to explain every and each drug that we would recommend. And some of them were also seen in other countries in Central America, in Guatemala, El Salvador. So the entire the Central American countries, most of them, all of them have an early treatment protocol, and you can go over and search the web for them, and they are all very similar. And remember, randomized control trials and research takes a lot of time to get published, and we've been able to do some publications. However, we were fighting really hard on the front lines of the ICUs. So it took a lot of time to have our protocols being published, but we were able to find time during the weekends to explain the Honduran doctors what we were seeing on the front lines.
So, yeah, so essentially what he was saying was that they put this together trying to find solutions. They did this not just in Honduras, but they expanded their knowledge to other countries around in Central America. And they were approaching this from an early treatment point of view. And you have to remember that this was part of the problem at the time. There was no acceptance in the broad scientific community that early treatment was at all of any value. In fact, anyone speaking about early treatment was considered to be misinformation. And this was part of the reason why this interview then got censored, because they were actually suggesting that a country that was not first world could come up with a strategy that would be better than what first world countries were doing. That's just unacceptable. That clearly can't be right. Early treatment would never work in reality, because if it did, it would have been done by first world countries. Isn't that the thought? So, within that framework was the situation with regards to Honduras. What was very interesting for me is, how was it that these doctors working on the ground were able to influence their governments to be able to do something that no other government in different parts of the world was able to do? Listen to this next section, this next clip from the video. Understand, how did you manage to do that? Is that normal for you to have this much access to the political arena? How does that work?
Not at all. Actually, I never became so involved with media until this time. I was very quiet. I would have my own private life, but that was a matter of patriotism. It was my country being hard. We had a case fatality rate of 17%. We would intubate patients and they would die. We would give them, I don't know, prophylactic dose of of enoxaparin, and they would die. So we had to change, and we saw and we showed the data that patient would come out of the ICU. We had a mortality ICU rate of over 70%, and we dropped that with giving ivermectin, with giving therapeutic doses of anticoagulation, trying not to intubate patients and put them on high flow, giving them um, tocilizumab as a rescue therapy, give them colchicine, and we'll show them the data. And then we will be, and so they invited us to this group of people to make the decision. And slowly we will be changing the treatments. And so they, we showed them that some patients were getting better without a wait for them to go to the hospital with some medication with antiviral potential, and they agree, and we started giving this treatment. And as the cases increased, we were hit really hard in June. So we made some recommendation, and I will show you in the rest of the slide how the effect of these medications affected the hospitals, and how we were able to hold up to the large amount of patients that were coming to the hospital.
But Fernando, there's a point, a principle in this that I'm
Mhm.
trying to see if I can dig out.
Mhm.
And the principle is that even in most first world countries, unless you are part of the government and unless you are part of the public health strategy decision making committees, You can't get the access to implement these kinds of things. I am genuinely trying to understand what was it. Is that a standard practice that you guys have that much access to the politics? I'm really fascinated by that.
No, I think one of the things that helped a lot was that some of the politicians got sick. We
Ah,
treated them. Actually, the president of Honduras got sick, and we had the experience of San Pedro Sula as being, and we treated them with, on you know, with we helped the doctor who treated the president of Honduras, and we gave him steroids, anticoagulation, everything we'll share right now. And his wife got sick, and some ministers got sick, and I think that helped.
well, this is what I'm saying.
What a better experience for the politician. I got sick. I was, I had a very high risk to die, and the physician treated me. We treated a lot of ministers. We treated the president of the court. We treated the president. We treated the first lady. We treated a lot of them. So I think that's what, and the other thing that helped is that we made a team. It was a team effort of all the intensivists of Honduras, first of San Pedro Sula, and we made these recommendations as a team, and we had a very good and clean record. Everybody knows the intensivists of San Pedro Sula because we are just a few, and we made a team with the infectious disease doctor, and we brought up all the best evidence at the moment to treat our population.
Yeah, and that's what they did. They took what they had on the ground and they made a difference for their population. That's medicine. That's what I think the public expects of the scientific community, the medical community, that they are doing everything in their power to find solutions. They're not waiting on someone to tell them what to do. They are working hard to try and find ways, innovative ways, to make a difference to save patients' lives. The reason this is so important, and just so you understand where I am, my concern at this point in the pandemic is that we are at the equivalent of March of 2020, before the pandemic hit the rest of the world. And if you had told the rest of the world that there were going to be lockdowns, there would be all these deaths, nobody would have believed you. My concern is that we are at an even more dangerous time now because we're still having high circulating virus. The difference is going to be how people die. It will no longer be severe COVID 19. We need to go back to the drawing board. It requires all of the scientific community, physicians, scientists, researchers to sit down and try and figure out what could happen next. We need all the resources we can. And we have to be focused on outcomes. This is the point that I say. As a clinical researcher, I'm interested in outcomes. If somebody told me that drinking 2 liters of water a day was going to make a difference to mortality, I wouldn't say it was impossible. I would want to understand why and check and see if it's working. Why is it working? What is the mechanism? Because it's important to understand the disease. So when it comes to outcomes, it's very difficult to beat what Honduras did. This is from our World in Data today. Okay, so this is showing you what happened. They had their peak in deaths. This is COVID 19 deaths. And this was their peak. This was in about September 2021. It's a bit more difficult to see with that image. So I'm going to share it here on the live sir. Yeah. Oh, I think I've lost that page temporarily. So I'll just bring this up back up again. So you have this peak in about September 2021. It then crashes down into about December, and then they have another peak here. This would be Omicron, and then after that, the pandemic is largely over in Honduras. That's an outcome. That's a very serious outcome. And I have not seen anything anywhere else in the world that is as good as what Honduras did. How was this information censored? Why was it censored? Why was the scientific community not interested in listening to what they did, how they did it, and why they did it? The last clip that I'm going to play from this, I had to clip out some bits. And it's very sad that, from a scientific point of view, I'm not able to be as clear as I'd like to be in order for you to understand a little bit more of the science. But let's hear what he had to say. Realize that the minute you mention two words,
Hmm.
that you then fall into the category of misinformation.
Hmm.
How does that make you guys feel when, I guess, the world is criticizing your methods, even though you may be getting results?
Okay, so I mean, first, I my work is to save patients in the ICU. It's not, I if the people criticize me or not, I don't really care. I know I am a doctor that was trained to treat patients, to have patients survive in the ICU, and we didn't have the ICU beds as England does or the US does. So we had to treat the patient what we had, and we had experience, we had a good faith, and we had the data. So if treating patients before was causing 70% of death, and after treating that, we would drop the case for so we drop the mortality to 14% in the ICU. So what stronger evidence than that? So I don't know if I say a lot of doctors around the world use it with good success. Why is that it has not been proven that it works? Because it's given too late.
Fascinating. That's the opinion from an ICU doctor in Honduras that dropped his mortality rate from 70% down to 14. At the end of the day, outcomes matter, not opinions, not what you think should work, not why you think it should work. Outcomes matter. Again, I show you this image. This is where Honduras is now. This is up to September 2023. Whatever they are doing, the rest of the world should be following suit. At this point in the pandemic, it's not important that whatever experts are the ones who say they should be the experts. The experts are the people who are getting the outcomes. And that's what we are seeing. We need to change the way how the world is operated. It's important that outcomes are central to how we practice medicine, how we focus on therapeutics, how we identify them. Really, really important. The final point that I want to make is about this remarkable, unique drug that I have silenced in parts of it because it could still cause controversy. But let's be clear on my position. I am one of those scientists who, as I said, observe and try and understand why people think something should work. If it works, the question is, why does it work? You don't discount that it works if it works. You try and understand, even if it is working partially, you still need to understand why it works. So here is what I learned recently, and I'll share with you. This was in January 2023. This was a paper that was produced where they took SARS-CoV-2, they took the virus, they created airway epithelium, and they infected the epithelium with the virus. And then they observed what would happen. And as they observed, they saw that the virus did very specific things as it was going through its process of infection. Now, look carefully at this next picture. This is a picture of what they saw at 6 hours, 24 hours, 48 hours. The virus, and I'll make this big screen here, the virus binds to motile cilia above the mucus layer. So this cream area here is mucus. This over here would be air. The virus binds to the top of the cilia and it propels its way down gets inside the cell and then infects it. What happens next within 24 hours? The virus, by acting on two particular proteins here, PAC1 and PAC4, it caused these tiny microvilli to grow like trees. And as they grow and they appear above the mucus layer, the virus can spread within 48 hours undeterred. The principle is anything that inhibits PAC1 or PAC4 will impact on the ability of the virus to spread in the person and to others. As simple as that. Now, the drug he was talking about has that impact on PAC1. And if you want to see more about what I was doing with that PAC1 research, click on the link where I was talking about that with regards to how this particular drug, one of the mechanisms, not necessarily the only one, but what I thought was probably one of the most important mechanisms for why it worked. The principle is simple. Where we are at the moment in the pandemic, we have to reduce population spread of the virus. If you underestimate this virus, it seems to cause mild disease in that it no longer causes severe COVID 19 as much, but it doesn't mean it's still not killing people. It just happens within about 2 to 3 months. The mechanism is completely different. And that's what is lulling people into a false sense of security that everything is okay. Based on my predictions around autoimmunity, the likelihood is that we are moving into the worst phase of the pandemic. We need every tool we can find. We need every scientist, physician thinking, working, finding ways that we can impact on what could be an awful state of the world in another year or two. This is quite serious. I'm not saying this to frighten anyone, but I think it's important to be clear that I am more worried now than I was in March 2020, and I was worried then. This is serious stuff. Let's see if we can learn to look for outcomes. Whatever works needs to be used, not what we think works, not what we think should work, but only what works. The combination is extremely valuable, and we have to learn how to combine things to get the best outcomes for our patients. Thank you very much for listening. I hope you found this valuable. This was an important piece of information, and I think we all need to learn from it for the future. Have a great evening.